I'm Noah Hayden, and this is my video on IV administration. First thing I'd do is come into the patient's room, perform hand hygiene. And I would don gloves. We're going to get ready to hang a bag of IV fluid after ensuring the physician's prescription, noting it in the patient's MAR, and then we will gather our supplies and hang and prime the IV bag, then attach it to the patient. So you need an IV bag and you need your set of IV tubing. This is IV tubing. This is the spike end. This is the roller clamp, which controls the rate of flow of your IV fluid. This is the Y adapter. And this is the adapter hub. This tubing, according to the manufacturer, flows at 15 drips equals 1 milliliter. So then we're going to go spike and prime our bag. You need an object to hang your solution on so that you can prime it. The first step is to close your roller clamp all the way so the fluid does not begin to flow immediately. Then you're going to remove the sterile tab on your IV solution. And using the aseptic technique, you're going to remove the cap off your spike and insert it into your IV bag. You're then going to prime the drip chamber by filling it 1/2 to 3/4 with your solution. Then you're going to prime all of the air out of the IV tubing line. In order to do that, using aseptic technique, you will remove the cap from the end of the adapter, and then you will fully open your roller clamp in order to allow solution to flow through freely, clearing any air bubbles. For this, you'll need a trash can or some other material to absorb any fluids that you're leaking out of your catheter. And you'll want to ensure that there is no air present in your IV line as you flush it through. Once the IV is flushed, you will clamp the roller clamp. At this point, you can connect it to your patient's IV. If this is a new connection and you're not replacing a current line, you will need to wipe the IV hub with a alcohol wipe, allow it to dry, and then since this is your first time attaching it, you want to very gently secure your lure lock, and then you'll want to open your roller clamp enough so that you see a drip begin to form in your drip chamber. So you just want it to be able to stay open. So for this particular doctor's orders, he would like to give this fluid at 150 mils per hour. So you'll have to figure out how many drips per minute you're going to need to deliver 150 milliliters. So since the drop factor on this particular tubing is 15 drips per milliliter, you will take 150 milliliters per hour, convert that to however many minutes, and then multiply that by 15 drips per minute, which will give you your overall drips per minute factor. So as you can see here, I performed the math, have 150 an hour, 1 hour and 60 minutes, 15 drips for 1 ml. You eventually get your math over here, totals out to 37.5 drips per minute, or rounding up 38 since you can't count a half a drip. So at this time, using the clock on the wall, I'll begin counting the drips for a full minute to determine how many drips per minute are coming through this chamber, and I will adjust the drip factor with the roller clamp as needed. 1, 2, 3, 4, 5, 6, tell that's too fast, I'm going to slow it down. Now you want to ensure that your IV bag hangs at least 30 inches above the patient's IV insertion site in order to get proper drips and proper flow rate through the IV tubing. I'm going to try again. We're still a little slow. So there's 38 drips in a minute. So we're going to go ahead and leave that flowing at the 38 drips per minute as ordered. And we've also noted, and we're going to label our IV. So this way the nurses know when this IV was started and when it needs to be changed per facility policy. So I'll initial it, and I'll put the start time, which is 6/1 at 16:45. And then I'll place my label on my IV tubing so that the nurses after me can verify and then change as needed. Looking at the doctor's orders, we've also seen that the doctor has ordered a prescription for amoxicillin 250 milligrams in a 100 milliliter bag of saline solution to be delivered in 15 minutes. So I would go and speak to my patient and check his name and date of birth. Hello, Mr. Johnson. I see you're born on 1/7/1955. I'm here to give you a dose of amoxicillin as ordered by the doctor. Do you have any allergies? Any penicillin allergies, latex allergies, allergies to any medications, food, drugs? No allergies? Very nice. All right. So for our supplies, we'll need a piggyback extension. We'll need the 100 ml bag of saline. And we'll have to go to the MAR, verify the orders again via the doctor, grab our amoxicillin 1 gram. It needs to be reconstituted. This is amoxicillin 1 gram. Verify it, verify the patient's name again, verify the order, and then we're going to go ahead and prep our solution. In order to do that, we're going to first prime the antibiotic line. Okay. this one, to begin the prime, we're going to go ahead and hang the line. They've given us a hook. I'm going to hold off on that for a moment and just hang that for there. I'm going to go ahead and prime my piggyback extension tubing and position my roller clamp halfway or so. Again, I got a spike, roller clamp. This one has no Y adapter because it's a secondary line. And I have my hub. I'm going to clamp my line using aseptic technique again. I'm going to remove the cover on my tubing. I'm going to aseptically insert my spike, prime my drip chamber to half, and then I'm going to go ahead and flush any air out of this. Aseptically reapply my cap. And now I'm going to prepare to reconstitute my medication, at which point I will need a 10 cc syringe, and an alcohol wipe. According to the instructions on the amoxicillin, for IV, reconstitute with 9.6 milliliters of IV diluent, specified for the insert. Each milliliter of solution contains 100 milligrams of amoxicillin. So I'm going to go ahead and place that down here. I need 9.6 mLs. I'm going to secure that from my bag of solution by inserting into the chamber, filling with air, and drawing 9.6 . And then I'm going to reconstitute my antibiotic solution by filling the chamber ensuring that all of the powder has dissolved. Okay, and then I need 250 milligrams of my amoxicillin solution, or my amoxicillin drug. So if you do the math, if every milliliter has 100 milligrams, I'm going to need 2.5 milliliters in order to get 250 milligrams. So I'm going to draw two and a half mLs into my syringe, and then using aseptic technique, I'm going to inject that into my IV solution. I will dispose of my sharps in the sharps container. And then I will adjust my IV so that my IV solution, my primary, is below my piggyback line. This will allow the piggyback to flow in easily. And then I will take my adapter and I will attach it to the Y port located near the patient. Because this is a new connection and the Y port is uncovered, I'm going to wipe it with an alcohol wipe. Using aseptic technique. I'm going to attach it. And then the surgeon would like it to, or the prescribing physician would like it to go over 15 minutes, the entire 100 milliliter bag. So again, I'll have to figure out how many drips per minute I'm going to need for this. This tubing is also 15 drips per ml. In order to figure that out, I will need 15 drips per ml. I'm going to need 100 mLs in 15 minutes. I won't have to convert my minutes, so just multiplying across. 2250. No, I get 15 times 100 is 1,500. And then we're going to divide that again by 15. And that means I need 100 drips per minute in order to infuse this solution over 15 minutes. I'm going to go ahead and open my chamber. So that my solution flows. I'd again time it to make sure that my drip rate is flowing at the correct rate. And then I would add a tag onto my solution stating that the patient's name, Mr. Wilson, and his room number, which drug we're using, which is amoxicillin, 250 milligrams in 100 milliliters of normal saline, and it's to go at 100 drips per minute. Total time will be 15 minutes to infuse. And this way, anybody knows that this isn't just a regular IV bag, it has additional medications in it. That's how you set up IVs.